Best Life Wellness Expo here at the YMCA. I'm Joliyah Daughtry.
I'm Evan Thomason.
And we're going to go ahead and kick it over to Trevor Blackstock. You are a year 3 medical student. Can you kind of just talk to me about, how you started in med school, things like that?
Sure. So as you said, I am a third-year medical student training at LSU Health Shreveport at the LHS 5-Star Cancer Center as well. And this journey started 3 years ago, applying to med school. I knew I wanted to be a doctor from an early age. There's a lot of complex medical issues out there, and I felt that doctors weren't really explaining everything when we went to the doctor, so I kind of wanted to take a step to be the one that did explain everything to patients, especially my interest in the field of psychiatry with mental health.
Wow. So are you enjoying the Wellness Expo today?
I am.
Kind of talk to me about the things that you're seeing just in the building.
Sure. So I like how there's all these different kind of booths out there, so really anybody out in the community would benefit coming out here, regardless of what issues you may be experiencing or any health screenings you want to get today. I think the information provided here is very well structured for anyone to understand in the community without having a medical degree.
So you're going to be giving a presentation on the main stage, the big stage. Are you excited for it? I hear it's a meditation. How is that?
Yes, I am excited for that. I think one of the goals of the meditation session would be to kind of clear up any kind of misconception of what meditation is and how easy it is for people to do it. To kind of promote more mindfulness and wellness in the community, because anyone could really benefit from it.
So how does that exactly help you out or help anybody out with their daily lives? Because I know sometimes you need meditation to kind of calm yourself and calm your nerves. Is it that kind of feeling exactly?
Yeah, so it's kind of a different thing for everybody, but that is kind of the main goal, kind of clear your mind, kind of get you rooted in the present. And one of the interesting is there is a form of meditation where you can kind of walk around and do, 5 things I can see, 3 things I can hear, that kind of thing. And that's kind of one of the things we kind of exercise at our weekly cancer walks with our cancer walking group. Every Saturday we meet at Betty, Virginia Park, 9 a.m. to kind of walk with the local cancer survivors. And we'll be resuming those walks in August, on August 2nd.
So can you kind of just talk to me about the importance of meditation, just to kind of, put that mental along with everything else in your life?
Sure. So I know, everyone has really busy schedules with our jobs, our house activities and everything. So it's important to get, even 5 minutes a day is enough to kind of help mentally reset you and kind of get you grounded in the moment. And there's really a big relief to kind of slow down, from the day-to-day activities and just kind of give yourself times to relax and be there for yourself.
And that's really cool. So I definitely feel the stress on my shoulders after getting home from work. That's for certain. So do you have any particular, meditations, exercises that you can kind of pinpoint to our viewers here at home of just what exactly can they do in the moment, especially getting off some of that stress, especially at the end of the day?
Sure. So funny you mentioned, feeling kind of stressed in your shoulders. One meditation technique that's really easy to do is the body scan technique. So essentially what you do is you kind of put yourself in a quiet room and you just kind of focus on different parts of your body. Start from your head, work your way down to the toes. And what you'll find is sometimes you'll kind of fixate longer on a certain position on your body. And that's usually where you're carrying a lot of your stress. And if you feel like you have a lot of stress there, you spend a little more time there thinking about it, just kind of slow it down, okay, and imagine the tension leaving your body. And that kind of finds to help people.
So talk to me just the importance about just slowing down sometimes. You're saying, you should meditate, but I think people really don't slow down as much as they should. Can you talk to me about the importance of that?
Sure. So it's important to kind of slow down because we kind of get lost in the day-to-day activities, and what this kind of lead to is sometimes it can lead to a lack of self-control. So there are studies that show, particularly in alcoholic recovery programs, that people do meditate, they have more self-control over different kind of cravings and addictions. So we can kind of see when we take that moment to slow down, we can get a better control over our day-to-day lives and essentially can lead to better outcomes overall.
So is it almost like you're getting lost in the moment? You're getting lost in this whole repetitive, routine, so to speak?
Yeah, and that's kind of one of the things. Meditation, like I said, it's kind of like a mental reset to kind of get you out of this routine to where you're not just going through the motions, you're kind of actively choosing how to live and how to act in the day-to-day moments.
So what are some common misconceptions about meditation that you kind of want to debunk and just let people know? What are some that you have?
So one of the common things I hear about when I mention, you should try meditation, they said, I don't want to just sit around and hum. A lot of people think you have to do that or you have to do intensive yoga to meditate. Like I said, you can make it as passive or active as you want. Like I said, the walking around, 5 things I see, 4 things I hear kind of thing. You can do that. Also painting or listening to music. Just something to get your mind fixated on one particular thing. That's not all the daily stresses you're experiencing.
It's intriguing you mentioned that because it's almost like using your different skill level. Like you're looking at something, you're hearing something, maybe you're even smelling something. And so just usually using your senses to really absorb and take in the moment, so to speak.
Yeah, and that's kind of the thing, all the five senses, you're engaging your brain in different things that are not worrying about different stressors in your life. And that type of meditation I'm going to guide people through today is a guided imagery meditation, which really calls on you to exercise your imagination, but then also I'll have the audience have moments where they kind of pick out and think about different memories of their past to kind of bring them, warm feeling.
Now, is meditation just something that women should do, men should do, children, everybody, and how often should people be meditating?
Sure. So I think something that everyone can do. Younger kids maybe a little more instruction or guidance in it, but I definitely think anybody should do it. And one of the things that I think people should do is set aside like 5 minutes, beginning of the day, end of the day. Really, at any point you find that you have some time to spare, I think it's worthwhile to meditate.
Yeah.
That's really cool. So, I mean, you're here at the Wellness Expo. First of all, you're I believe a medical student, third year, LSUS, the Health Report. Tell me about how that journey has been and how you've, obviously you're outreaching here on a Saturday as well, being able to come out here, which we appreciate very much. Talk to us about how your journey has been through the medical field and what your goal is once you, roll through and graduate. That's really cool.
Yes. So I'll be participating in the match next year in March. So I'm applying in the field of psychiatry. So really for the last 3 years, it's been a lot of clinical training classwork, but I've really enjoyed the most getting to interact with all the patients out in the community and in the clinics. And like I said, the cancer walking group we've had, that's been a great outreach for us for interacting with the local survivors, local patients, just get a lot of patient interaction in. So I think that's really been the most rewarding part, is kind of seeing how we can touch and transform patients' lives in a positive way.
Well, Trevor, thank you so much for joining us, and good luck on your last year of medical school. We will be right back with Live Your Best Life Wellness Expo. Stay with us.